My name is Dr. Shefali Agarwal. I'm a senior consultant in surgical oncology at Indraprastha Apollo Hospitals, New Delhi. And I'm a surgical oncologist trained from the US, from Roswell Park Cancer Institute in upstate New York. I further subspecialized in hepatobiliary and pancreatic surgery from Johns Hopkins Hospital, Baltimore. I returned to India 3 years ago after spending 18 years in the topmost institutions in the US, most of which was dedicated to surgical oncology and the various cancers which come under the purview of surgical oncology. My mandate today is to talk about breast cancer, which is one of the two commonest cancers in women in India, the second one being cervical cancer. Breast cancer is important because it's one of the few cancers where we have tools to screen, to detect the cancer early, detect it at what we call downstaging of the breast cancer, and which leads to improved survival, lower mortality, and less aggressive surgical treatment. So how are these three goals achieved? The best way to achieve them is through screening mammography. Screening mammography is nothing but a sophisticated X-ray of the breast. It is not the same as a routine chest X-ray. This is done in a specialized computerized manner. So one should not be misled into having ordinary X-rays as being considered to be mammograms of the breast. However, it is not expensive and they are readily available in most parts of India. And if they're not immediately accessible, if you try to find out through your doctor, within a short distance, you'll be able to find either a mobile mammography van or a clinic or a hospital, which will give you access to mammography. And the mammogram is nothing but an X-ray in two axes of the breast. It helps to detect cancers when they are very tiny. One of the big differences which I have noticed in patients with breast cancer that I'm seeing in my clinic in India and those which we saw in the United States is that Indian women usually come to me when the cancer is palpable, which means that she can feel a mass or a lump in her breast, or her gynecologist has felt a mass or lump in her breast. 90% of the breast cancers that we see in the US are detected on mammogram, which means that these women were having regular mammograms every once in a year or once in 2 years, and the cancers are so small that they're only detected on X-rays. So we detect cancers at much earlier stage in the US versus India. They're usually stage 1. The survival of stage 1 breast cancer, when appropriately surgically treated, is in excess of 90%. So 90% of these women will live more than 10 years. Whereas when you detect breast cancer at stage 3, the survival falls dramatically to about 50 to 60% for 5 years. That being said, breast cancer is readily treated, even if it is detected in advanced cases, and the modalities of treatment are fully available in India. So I would encourage all women to have a screening mammogram starting at the age of 49, and a mammogram should be done once in every 2 years.